Anna has been attending to her 85-year-old grandmother with diabetes. On Sunday afternoon, while her grandma was cooking for their lunch, her grandma broke her hip trying to reach for the salt in the cabinet. Given the reason, her grandmother has been confined to bed for 3 months now. But Anna can no longer manage seeing her grandmother bedridden. So Anna called her friend to bring her grandmother to the hospital to be checked.
Yes, good morning. May I know the patient's name?
She is Olivia Rodrigo, 85 years old. She has diabetes, sadly confined to bed for the past 3 months because she broke her hip while she was in the kitchen.
For the test, we will have an ancillary blood glucose test for your grandmother. In this procedure, we will prick blood in the portion of your grandmother's hands and then test it in the glucometer and then check if her glucose level is high or low.
The test was performed and results are awaited. They will be waiting for the laboratory result for hours, so they have to stay in the hospital for monitoring.
May I know the patient's name, please?
She is Olivia Rodrigo, Doc.
So I already have the results here. However, I wanted to add a blood test and a routine urinalysis just to make sure. As for the ancillary blood glucose test, she has 250 milligrams per deciliter, which is pretty high. So this means now that she has a glycosuria when the amount of sugar in urine is greater than the normal range. It's considered glycosuria. This can happen for a few different reasons, including the high blood sugar levels, or if your kidneys are not able to reabsorb enough glucose or excrete it to keep it within a normal range. So I hope you guys will visit an endocrinologist as much as possible and as soon as possible.
Munique, an intern in the hospital, collected the blood of the patient. Sample was then received by the registered medical technologist, and Miss Yu was just observing the process. And after waiting, the results are ready. The physician and Miss Yu went to the patient's room to give and discuss the results to Anna and her grandmother. Anna, however, has no idea what the physician is talking about, but she asked,
Doc, I was curious as to why my grandmother has a yeast infection and why it is common with diabetes mellitus, as you have said earlier.
So yeast candida albicans or yeast is seen in urine of diabetic patients. The acidic pH, since it's 5.5 in the case of your grandmother, and glucose in the urine of diabetic patients provides good medium for yeast growth. Yeast feeds off of sugar. If diabetes isn't well controlled, your blood sugar levels can spike to unreasonably high levels. This increase in sugar can cause yeast to overgrow, and your body may develop a yeast infection in response.
Doc, I have known with a urine and glucose test or something. In relation to the previous result with a blood glucose level of 250 mg per dl, should glucose be present in the urine?
Yes, this exceeds the renal threshold. Glucose is present in glomerular filtrate, but it's reabsorbed by the kidney's proximal tubule. If the blood glucose level exceeds the capacity of the tubules to reabsorb all the glucose present in the glomerular filtrate, the renal threshold is reached and glucose spills into the urine.
Thank you, Doc.
while walking, Miss Yu and the physician was conversing about the results.
Doc, I was just really curious. Is there a discrepancy between the negative nitrate and the positive leukocyte esterase results?
No, yeast is not capable of reducing nitrate to nitrite.
How about the major discrepancy between the chemical and microscopic results, Doc?
Moderate blood with no RBCs. The result of microscopic analysis shows only 20 to 25 WBCs over HPF or high power field.
Oh, so what's the most probable cause for the discrepancy, Doc?
You know what, Miss Yu? Too much about your curiosity. I'll be leaving the question to you. Report it to me tomorrow. ASAP.
Myoglobin caused the positive chemical test results of blood. Due to muscle destruction, the patient is bedridden since 3 months. Myoglobinuria is associated with destruction of muscles. Patients with conditions related with muscle destruction are suspected for presence of myoglobin in urine. Oh, so this is how this works.